Hi everybody, this is Dr. Hinson. I wanted to make another video today discussing something I see in the office pretty frequently, not only amongst everyday people like you and me, but also a lot of the athletes I treat and the weekend warriors as well. And one of the things that is tight hamstrings or pulled hamstrings. It's something that you see in runners and in any kind of athlete that requires sudden movements of power or explosion of movement. It's very common to see people complain of tight hamstrings, and it just so happens that our guinea pig in demo today has exactly what I wanted to show, so I wanted to take advantage of this opportunity to show you before I fixed her. So when people complain about tight hamstrings, a lot of times they'll complain of pain in the upper hamstring up in here, or sometimes down in the lower hamstring, or the whole thing might just feel tight in general. Many times what will end up happening to those individuals is that when they try to go get therapy for those tight hamstrings, they either have the hamstrings e-stemmed or ultrasounded or iced and stretched, which is actually one of the worst things you can do for a tight hamstring. In actuality, you have to think of the hamstring as a bridge between two important areas of the body, the glute max, or the butt muscle, and our calf muscles. And so the hamstring is kind of like the person caught in the middle. So anytime there's a problem here or here, the hamstring will tighten up. So the first thing we're going to discuss is the glute max. The glute max is a powerful muscle that helps us when we're running and extending our leg. And many times when that muscle is dysfunctional, it can cause pain or tightness in a hamstring. So for example, if we were to check her glute max and we had her point your foot down there and have her push up to the ceiling with her legs straight, so push up for me, she has a hard time doing that. Okay, we could also check the other glute max. Okay, push up again, and that one isn't working either. So we already know she's got a glute max dysfunction of some sort, so we're going to have to kind of figure out what that is. The other muscle that we discussed that can have a big effect on the hamstring is the calf muscle, or the gastrocs here. So these are also important muscles that help us, push off in our walking and our running. So if we were to check her gastroc function, point that foot and push up against me, she can't do that either. Now, here's the thing. A lot of times people are trying to fix this area here, when in reality the weaknesses are here and here, or both in her case, or sometimes it's just either or. So what's interesting about this particular problem here is that if we have her reach back and touch the back of her skull, let's go ahead and put your hand right there for me. If she touches the back of her skull, I know you can't see that on the video, and we have her bring this up again and push up, she can now hold that really well. And if we have her do this here, push up again, she can hold that one really well too. So what I'm having her do is touch a part of her upper neck that I know many times contributes to glute max weakness. So a lot of times all this therapy is being done here whenever the solution is further north or south. And so one of the things you'll see in someone when they have tight hamstrings as well is they'll have a lot of trigger points in here. Okay, so tell me when I hit one. Yeah, right about here. So right here about the lower part of the calf muscle, you'll find some trigger points. So if you're having chronic hamstring problems, if you just want to look in this area, find some trigger points and massage and rub those out, that might be very beneficial. So the other muscle we want to talk about that plays a role in all of this is a muscle that's underneath the calf called the soleus. So if you bring the leg up here and have her point her foot, and you push back, that's really hard for her to do. Okay, so she's got several muscles weak, and actually if we were to check the hamstrings themselves, push up, she can hold those really well. Push up. Even though her hamstrings, she's complaining of tight hamstrings. So a lot of things, the biggest thing I would tell people, if you're having tight hamstrings, one of the worst things you're going to do, even though you're going to want to do this, one of the worst things you can do is stretch the hamstring. Okay? Usually what I would tell you to do is look for trigger points here, sometimes up in here in the butt muscle on both ends. If you poke around in here, you'll find that. And so many times I find that there's usually biomechanical problems in the pelvis itself, because look, the hamstrings attach from the knee all the way up into the butt. And so fixing the pelvis, you'll find biomechanical problems in the pelvis, and in her case, you'll even find an upper neck problem that's contributing to both of her glute max muscles not working right. So I hope this was informative. If you have additional questions about hamstring issues, one thing I will mention though, there's obvious, moments in which the hamstring muscle is torn. That's where you'll have to direct some therapy to the hamstring itself. But most of the time, that's about 2 or 3% of the time. A vast majority of the time, most tight hamstrings are because of calf and glute max. So if you have any additional questions, shoot me a direct message, send me a message on my Facebook page, and I'll be happy to answer any questions you have. Thanks.